do you wish to repeat the same video to observe the patient or observe the persons? So I will repeat that. What you observe from this? Are you all hungry at 11 o'clock? Okay, fine. So my purpose of putting this video is not to understand the person has many emotions, but to understand the different facial expressions according to emotions. Whenever any patient comes to you in your clinic and they are not telling anything, but their face is telling everything to you, so you have to understand that things. This is what my purpose of putting this video in these presentations. So coming back to our cases, so there is one of the acute case of viral fever. It was a case of a child. The fever since yesterday. There is a mild cough. The child was very irritable and cranky since the morning, and the salivation was plus plus. Generally, this child came to my clinic is very cute and having very interactions with me. But today, since morning, he had a fever, so that child is not looking at me. So I purposefully write that evading the look. The thermal thirst was normal. Stool yesterday constipation, but today mother says today morning he passed the stool. Urine was normal, slightly yellowish and slightly offensive. So I asked about what happened within 2-3 days. The fever comes and everything is irritability. So you have to ask about something ailment from. So what mother says that 3 days back, mother and child went to some of the social functions where child was very irritated and does not like to be with the stranger. And everyone in functions tried to give love and try to make a lovey-dovey with the child, caressing him. But this child does not like that and he become very irritable from that function. So it was the functions of baby shower and all are there. And this was a child of 1.5 year old, almost 2 years old, and this child having a very cute child. So everyone want to make give love and playing with them, but the child was irritated. So what mother says that the reaction that even કોઈ વાલ કરે તો irritate થઈ જાય, even કોઈ ગાલ touch કરે તો એને નથી ગમતું. That means I will convert into English that if someone gives affections toward the child become irritable, and if someone is touching their cheek, he doesn't like that. So from that day, after coming to home at night, he awakes from the sleep and cries suddenly in midnight after 12:30 to 2 a.m. around it, and this happens since 3 days. And since yesterday, he had a fever. So what could be the possible rubric you can think of? Yes. So everything has given. Touch aversion to be very good. Anything else? Chamomilla, Dr. KG has given answer. KRS aversion to be, KRS aversion to reject affections, very good. Nitric acid, sin affections, reject affections, absolutely perfect. So what I did is this is evading the look. So whenever any person is evading the look, what could be the possible rubric you can think of? No, the person is not giving you affections or evading. So what could be the possible rubric you can think of? Mood fretful, child cannot be touched or looked at being evading the look of persons. Absolutely, Gaurav. Want to stay alone, absolutely shy, you can think of. So whenever any person is evading the look, so we have a lot of rubric in our repertory that I evade look of the others, anger looked at when, fear at looked at, fear of observe of her condition being looked at cannot be at, morose sulky looked at when, weeping children looked at when, or weeping looked at when. So what could be the thing we can think of? Okay, so these are the many rubrics in the repertory we had. So what could be this? So in that, what I understood that the child, a small child needs love, and here the child goes into a state of syphilis. He does not like that love. This is what KRS aversion to be. So KRS ailment from. So this is what touch aversion to be, anger caressing from, indifference KRS to, quieted cannot be, patting and caressing are of no use, and weeping caressing from. So these are the few other rubric you can think of. Absolutely angry personality. So the rubric, the things which I took is what happened. First and foremost, the presence of stranger. He went to social functions. So all are the stranger for the child. So presence of stranger aggravate the child. That was the one thing. And second thing, child does not caressing. So caress aversion to being. So on the basis of that, in acute conditions or crankiness, I prescribed Sina 1M 3 dose hourly. The next day, mother called me that my child was absolutely normal. He slept well overnight and no fever. So this is what you have to observe, very precise things. Moro's rubrics. Dr. Shadav, you must read Sir's frequent encounter. You, you will get idea about the Moros. For potency also, you must need to understand certain clinical experience. It is my clinical experience. Whenever I find it is a acute delirious condition, I used to prescribe 3 doses or sometime hourly 2-3 doses to come down that into normalcy. That's why I had prescribed 3 doses, because of child is very cranky and irritable. Hope this will help you. Fine. Another case, the case of female having acute neuritis. So what happened? Acute complaint started since today morning. In the morning, the pain and burning in the fingertips. There is a right hand fingertips pain and burning. Suddenly it started. It's like a numbness and burning feeling in the fingertips, and patient is telling only these symptoms, that there is a burning and numbness in the fingertips. And I asked about what you feel exactly, what was the sensation. So she said in Gujarati that એવું લાગે કે દરવાજાની આંગળી આવી ગઈ હોય અને કેવો દુખાવો થાય એવો દુખાવો ફીલ થાય છે. So she said that what happened whenever my finger is being in between the door, and it become what we called as squeeze in between the door, and that type of pain I had. That is what the patient has given sensations. Now what to take into this consideration? It is acute inflammations of the nerve. Without the trauma, she had this, and she gives this peculiar sensations. The case is closed. What to be prescribed in this case? Hypericum, delusion, injured sees, crushed finger sensations, Ballis perennis, extra pain finger as if squeeze. Yes, absolutely perfect. So what patient is telling us, we have to take into consideration only that only, not our interpretation. Delusion, injured being, injured see is the perceptions. Patient is not giving you perceptions. Okay, or not there is any protective or psychotic pathology which can be because of this delusion. It is just the sensations. So that is what delusion is not considered to be in this case. So the things which I took is localization, upper limb, fingertips. The location is most important in case, because the location itself is a PQRS. Why not other things is happening? Only this is because the part which is weak in the body, it is the sphere of actions. So remedy also having a sphere of action, that means that remedy has the weak part, that constitution has that weak part. So this location is most important according to Boger Boning Hussain. Second sensation she said is the burning fingertips. Third, she says that as if it is squeezed between door, okay, and crushed. So this is what the whole sensation, two sensation I put together, and in that case I prescribe causticum 1 m, again 3 dose at 10-minute interval in my clinic only. I asked the patient to sit for half an hour. After half an hour, she said there's only 10%. One finger has little sensation of burning and everything rest is clear. So this is what the acute condition is. Okay. Hope you get the idea according to this. This is what a different aspect of acute handling acutes. In first cases, I give you ailment. In other cases, I give you observation in these sensations and locations. So this is what you have to keep in mind. Okay. Then another case of acute fever. This is a 1.5 year old child uh, having a fever, mild cold and cough, and once vomited, heat of the whole body. And in my surprise, what I observed that the generally I used to examine the child. So I observe the child from head to foot, and when I am touching from head to foot, I touch the ear, and the ear was absolutely cold during the fever stage. Okay, this was my observation. So this was the simple case. On the basis of that, I took the Boger-Bonning-Ussen's repertory, and in Boger-Bonning-Ussen's it was written that concomitant ear cold during fever, and the only remedy is Ipecac. I prescribed single dose. Next day, child was absolutely normal. So this is what you have to understand from the point of view that the observations and application of observation into a case. Now, another aspect of dealing with the acute conditions when you don't have any symptoms, then what to do? Okay, so it happens in many cases. Can we think of partial chills? Chills is a different things and coldness is a different things. Okay. So this was the case of a pneumonia. We are going little bit fast because I need to cover chronic autoimmunity, and then the last one is cell psychobiodynamics. So be patient. Keep in mind we have to deal with that more than 2 hours from here on. Okay. So 28 years female came with the right-sided chest pain since 3 days, mild cough since 3 days, low-grade fever since 3 days. And the husband says that she lost 7 kg weight within 2 months from 44 kg to 38.2 kg. Her appetite was okay, thirsty, chilly. Now, from symptoms, what the things you have to observe? I examined the patient, and after examinations, I found there is a respiratory air entry reduced in right lower zone. So, what could be the possible things you can think of in this case? Weight loss, cough, low grade fever, and appetite was okay. What could be the possible pathology or diagnosis you can think of? Yes, tuberculosis, absolutely. So, what could be, yes, advice to investigate the TB? Absolutely, perfect. So, what could be the criteria for tuberculosis? The cough lasted more than 3 weeks, low grade fever, loss of appetite, night sweat, and so yes, absolutely, rule out the coughs. So, on the basis of the clinical investigations, I advise patient to go for X-ray as the patient was very poor. So she came with the X-ray report, and this X-ray report shows this. This is the reports on 21st of Jan 2020, 2019. Okay. So it shows that the homogeneous opacity seen in the right lower zone, no CBC, no ESR was done because patient is very poor. I will tell you because the next X-ray which advised by me, I had paid the patient For that, you can go with the X-ray for my understanding, my sake of knowledge. So she go for X-ray because of she is poor. So no tests were done. Only these things were done. Okay. Monto stents also not done. Nothing was done. Okay. But I had this. If it is a TB, what could be the diagnosis? What could be the X-ray report? Right-sided pain. And if it is a TB, then there must be a pleural effusion in the X-ray report. Okay, very important. So, but thus just I have these reports and nothing else in my hand to prescribe. What could be the rubric and what could be the remedy you can think of from this history only? Okay, we go to the back to the history again. Mild cough, low grade fever. Husband says 7 kg loss within 2 months from 44 to 38. Chilly, thirsty, and the X-ray report shows right lower zone consolidations. Okay. Don't jump to the remedy. Remedy is very easy. Everyone knows the remedy. Okay. But the process you have to understand. The clinical applications of the process is very important. Okay. And what could be the follow-up in your case? Emaciation, cough with very good new understanding. Right lung inflammation, lung right lower in emaciations. Yes, absolutely. Everyone knows about the things. So in that case, I just look at in the X-ray. As a clinician, I just think two things. Location is most important with the process. So location is inflammation lung right lower lobe, inflammation lung stage consolidation, because X-ray shows it's a consolidation. Now, as you know, that if it is a pneumonia, how many days to take to resolve naturally? As we know, the pneumonia pathology says that the stage of congestion, stage of red hepatization, stage of gray hepatization, followed by stage of resolution. So there are the 4 stages of pneumonia, and it will take almost 4 weeks. But nowadays, the advancement of the system, it took 2 to 3 weeks. Okay, as per books, it is said that the congestion stage lasting for 2 to 7 days, followed by red hepatization lasting for 4 to 7 days, followed by gray hepatization lasting for 4 to 7 days, and resolutions lasting for 4 to 7 days. So it may be a 4-week phenomena. Okay, now what is this? Third day, patient came. I prescribed on the basis of the same rubric. Iodine and phosphorus. The patient is chilly, so I prescribe phosphorus 200 single dose. Advise patient to give follow-up within 3 days. So on 24th of Jan, the patient came. Air entry bilateral equal is my clinical examination. So absolutely normal. Cara. Repertory is Cara. Okay, no chest pain. Appetite improve. Weight gain from 38.2 kg to 40.2 kg. It is good sign or bad sign? Good follow-up. Yes? Great. So I advise X-ray for my sake of understanding that pneumonia has resolved or not within 3 days. Okay. So I advise X-ray, and 21st of Jan, this is the 24th of Jan, within 3 days pneumonia got. This is the rapid, gentle, permanent restorations of health as said by Master Hahnemann. Hope you get understand from just the clinical rubrics. If you don't have any of this history, then also you can prescribe. Okay, I am skipping this. This was the case of muscles abscess in the calf muscles, and just took only rubric same abscess muscles deep in the calf. Calcarea carb was prescribed, absolutely fine within 3 days, absolutely normal. So we have end up here with the psoric approach. Hope you all get good idea of how to deal with the Psora. Now, Psoro-syphilitic. Look at this video.
अरे नहीं आता यार,
अच्छे से नाच लो, सब देख रहे हैं।
अरे मेरे को नहीं आता ना यार।
मैं कह रही हूँ ना, अच्छे से नाच लो।
ले ले नाच अच्छे से, नाच 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 अच्छे से, नाच खड़ी हो, नाच खड़ी हो, नाच एक बार तेरा बोल दिया, खड़ी हो खड़ी हो, अगर बोल दिया मेरे को डांस नहीं आता नहीं आता नहीं आता, समझ में नहीं आती क्या? चीजें चीजें आज कर लो, जब नहीं आता नहीं आता
फिर न्यू भी खून करा है।
तू नाच आया, तू नाच ले, नाच नाच ले, नाच 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 नाच, पागल कर दिया है
तू अड़ा।
अरे नहीं आता यार,
अच्छे से नाच लो।
What you observe in this? Absolutely, it's a funny, but for the purpose of learning, we have to be very precise in our learning only. Okay, what you have observed? Yes, rage and fury. Good. Anything else? Contradiction. Dr. Monica, sudden out. Yes, absolutely. It was written same. Absolutely right. Great. Sudden outburst. Anything else? Hysterical. Very good. So hysteria comes into this out of control reaction. Absolutely right. Humiliating behavior, violence, impulsive. Yes. So these are the rubric, but what we have to understood in context of the Psoro-syphilis. See, look at this video again.
अरे नहीं आता यार,
Up to this level,
अच्छे से नाच लो, सब देख रहे हैं।
अरे मेरे को नहीं आता ना यार,
मैं कह रही हूँ ना, अच्छे से नाच लो।
adapting to the
ले
situation.
ले नाच अच्छे से, नाच
Goes
नाच
out of control.
नाच अच्छे से, नाच खड़ी हो, नाच खड़ी हो, नाच एक बार तेरा बोल दिया, खड़ी हो खड़ी हो,
Not in
अगर बोल
over
दिया
control.
मेरे को डांस नहीं आता नहीं आता नहीं आता,
Also control.
समझ में नहीं आती क्या?
Still the reaction
चीजें
is
चीजें आज कर लो,
persistent.
जब नहीं आता नहीं आता
फिर न्यू भी खून करा है।
तू नाच आया, तू नाच ले,
Again,
नाच नाच ले,
the
नाच
trauma
नाच
comes
नाच
and the reaction
नाच,
is out of control.
पागल कर दिया है
तू अड़ा।
अरे नहीं आता यार।
So hope you understood that the in acute conditions, when anything which is happens suddenly and goes into out of control, either into a panic state, either into a anguish state, either into a delirious conditions, either into a hysterical reactions, you have to be very vigilant to observe these things. Okay, we are not in searching of any of the rubric from this, because this is not the case that we had, but this is what you have to observe, that whenever it is a so small sharp line that differentiates Psora from syphilis. Okay, so let's have a case of this Psoro-syphilitic. Hope you get yes, sudden loss of control, very important. So that is what we have to understand. So the case of acute bloody diarrhea, 34 years male came with the complaint of diarrhea since 3 days, and diarrhea with the pain in abdomen with urging and gripping calling type. So first day had a watery diarrhea, second day then mucus, then had passed blood in the stool since overnight, and he had 15 times diarrhea, bloody diarrhea. So I asked about why you have a diarrhea. So he said that I had a diarrhea because I had taken a laxative 3 days back, and that was the Indrayan to relieve the constipation. It's a home remedy. So this is what the case is only. Okay. Then he said it is a Indrayan, the laxative is a home remedy, vegetable substance. So I searched for that. Okay. So what is this? The first day diarrhea, soric, followed by mucus, Psoro-psychotic, and suddenly at night he has a bloody diarrhea. So control lost, and that is the syphilis enter. So this is what the fast syphilis is going on. So Psoro-syphilitic case, and we had the cause. So what could be the remedy and what could be the entry point? Okay. So yes. So first and foremost in this case, find out the acute fast syphilitic case, miasmatic Psoro-syphilitic. some syphilitic cause and the reactions. So what could be the reaction in this case? So whenever we are dealing with the Psoro-syphilitic case, you have to find out some of the sudden violent trauma. What could be the sudden violent trauma? Sudden violent trauma can be a shock, can be a fright. In both the above causes, suddenness has to be there. Trauma, a violent, strong, destructive and sudden. Faster the disease, sudden the disease and stronger, violent is the cause. So shock, insult, humiliation, abuse, honor wounded, sudden anger, sudden fright and panic state, sudden strong anger suppressed, sudden loss of loved one, sudden joy, sudden loss of business, money or prestige, some of the drug use and the separations and the physical trauma. So what could be the cause in this case? Is any emotion are there in this case? Absolutely not. Okay. So the cause is drug. So I search for Indrayan. What is the Indrayan? So in Google it is said that Indrayan is the bitter apple. It is something like a colocynth, and on the basis of that I thought it is the remedy to relieve the constipations, worm infections and urinary and rheumatism. So just rightly said by all that I prescribe remedy basis on the rubric is abuse of poisoning with medicament, vegetables, diarrhea, stool bloody, stool mucus slimy covered with the mucus, because we have a psychosis and syphilis is there, so we have to take the rubric for that. So on the basis of Nux vomica was prescribed, all are absolutely right. There are abuse of poisoning medicament with the vegetable. Two remedies are there, camphor and Nux vomica, but camphor did not cover the bloody diarrhea. Okay. So Nux vomica 200 given half hourly. So there is no pain, no blood, diarrhea stopped, everything was absolutely normal. So this is another case. So in Psoro-syphilitic case, you have to take into mucus. Mucus in the case is psychotic. Mucus is to protect the intestinal wall. The another Psoro-syphilitic case of male patient having a headache with dull pain since 8 days, investigated and admitted in hospital for the same diagnosis, diagnosed as a subarachnoid hemorrhage. Now anything comes into hemorrhage, we have the spear of syphilis. He was discharged after 3 days of the stay. Still he had a dull headache, and that headache is occipital vertex area, desire to sleep whole day, weakness, chilly and thirstless. Okay. Many of you know these cases because I had shared many a times. This was the report of the patients. The report on 25th of August 2017, subarachnoid hemorrhage in posterior fossa. CT angiography was done, and that suggests there is a spasm related subarachnoid hemorrhage. So the miasm is psoro-syphilitic, blood vessel spasm leading to hemorrhage. Okay. Repatriations. I'm going a little bit faster. Cerebral hemorrhage subarachnoid. The only remedy is gelsemium, and in a Fatak repertory it is written that apoplexy subarachnoid.